Talking about health, a lot of serious topics, a lot of serious discussions. Economically as well, there's a lot more to explore when it comes to health in India. And in this session, we'll be talking about nutraceuticals. It's now become a serious industry. It's no more a fad. Anyone you talk to, from probiotic capsules to even turmeric lattes, everybody is talking about nutraceuticals. And of course, our panel of experts here will be able to guide us more about what's happening in this industry, the latest innovation, and also the opportunity that lies for India, which boasts of having one of the most ancient wisdom in the form of Ayurveda, with cutting-edge technology happening right under our noses. Let me start with Dr. Awasthi. First of all, we were having this conversation about nutraceuticals as well backstage, and I need to ask you, this $100 billion industry that is being raved about across the world, how serious an opportunity is this for India? And also help us understand what's behind the rise of this industry.
Thank you very much for the invite. So, as you said, shifting gears from health to nutrition. So, I think this rise of the nutraceutical industry, I see it more as a reflection of the increased awareness that people have across the Indian market and across the world about the importance of nutrition and about the importance of preventive health, promotive health. I think COVID-19 served as a very, very important reminder to people across the world that beyond treating illness in a hospital, you really, really need to work towards holistic health. You need to invest in, I remember that before 2019, anybody who would be talking about immunity was considered to be unscientific. People used to be like, "Arey, immunity, it's not even scientific." And, so many things are given to, eat capsules and all sorts of juices to drink. And they said, this is all meaningless. It has no science. And your ghar ka haldi wala doodh means nothing because, it's all about allopathy and allopathic medicines, which of course serve a very, very important role in the entire public health scenario. But in the last couple of years, people have become very, very aware that micronutrient deficiencies is something that needs to be looked into. So when we talk about nutrition, we talk about undernutrition, we talk about these days obesity, overnutrition. There's a big problem in India, it's called hidden hunger, wherein India is facing the triple burden of malnutrition, and one of these being micronutrient deficiencies. So when I think of nutraceuticals, I think of it from the lens of, people don't even realize that almost 60% of Indian women are, say, anemic, right? Or more than 50% children, are deficient in iron and folic acid. From there to a large urban audience in this country, which is looking for supplements for that can work towards improving their immunity and wellness. So this rise in nutraceutical industry is really a rise in the awareness in the general population, which understands that yes, allopathic medicines are important, yes, treatment is important, but they are becoming smarter in terms of understanding that they need to make informed choices to improve and, improve their health from a more upstream way, wherein, whether it's antioxidants, whether it's, wellness supplements, there are a lot of Ayurvedic supplements which are there in the market. But I think that is really a reflection of how aware the market has become in terms of investing. And I mean investing even in terms of investing money into, their own nutrition and wellness. So that's really a reflection of changing times.
Well, on the surface, when you look at it, the opportunity seems endless as well. And Dr. Singh, that brings me to the point, very aptly she mentioned how a lot of our traditional practices are dismissed as pseudoscience. Whenever you try to suggest something to someone, they say कि ये सब पुरानी बात है, ये काम नहीं करता, focus on allopathy. But Ayurveda, a lot of people, experts say, even allopathic experts say that it is a treasure. How do we exactly validate this ancient wisdom that India has with modern science, so that at least on the consumer end, there is some sort of a credibility that is established, so that at least the products, continue to go into the market?
Thank you giving me opportunity by times. Today this nutraceutical is very, very important, and in 2021 actually, group of industries leaders, they have approached to the Principal Scientific Advisor Office as they were facing some of the challenges in this industry. One of the challenge was that, how they are exporting, they don't have any codes for that industry. So to have the codes, and another thing is harmonization, another point, and maybe some of the government schemes, because we know that nutraceutical neither it comes under, pharma or not under, nutrition products. So it is in between, and no direct ministry dealing with this subject. So with these challenges, what nutraceutical industries was facing, they have approached to the Principal Scientific Advisor to sort out or to have some solutions in this area particular. So for that actually then request came to CSIR, and I have been given this responsibility to take this challenge forward. So with the chairmanship, under the chairmanship of Principal Scientific Advisor to Government of India, we have constituted the task force, and wherein we have taken the members from different ministries, relevant ministries, including FSSAI, Ministry of Food Processing, and many industry leaders were the part of this task force. So in this actually, during the 3 years' time, we have come out, some of the, points, and we have also given the, to relevant ministry, to create some of the HSN code, because under different codes, these products are being exported. And under that, one remission of the, export product also under the Ministry of Commerce, that scheme also has been, used by nutraceutical industries. So with this actually, some of the, and now this has been now given to the Ministry of Food Processing, wherein now nutraceutical industry can get the help from the Ministry of Food Processing to use the certain schemes like maybe PLI, how to develop this sector, so that in future some of the challenges can be, taken care. And
absolutely. Dr. Singh, one of the interesting points that you mentioned is that there needs to be a collaboration across ministries, across different sectors as well. And that's where I want Dr. Awasthi to come in as well. We were talking about the fact that, there is a lot of focus on nutrition, but in reality, this industry sits right in between food and medicine. So in terms of regulatory compliances, in terms of, earning the consumer trust and also validating it globally as well, what are the sort of focuses that needs to be brought in, not just from the industry perspective, but also from the government perspective?
Right. So you've asked me two questions. One is winning consumer trust and sort of really positioning and framing the nutraceuticals in a way that it is scientific and also consumers understand what nutraceuticals mean. So number one, and then the second is the role of the government in terms of, how do you promote science-based products. I think the first thing that one of the challenges that nutraceutical industry is not just faced in India, but across the world has been that it needs to be understood. When a consumer is buying a nutraceutical, they need to understand it's not a magic bullet. They need to, when you're consuming your omega capsule or your probiotic, yes, I consume a probiotic besides having dahi, but you need to understand that nutraceuticals are not magic bullets, they are supplements. So I think correct, honest messaging has to be done on the product, not just because I'm saying that as a food first advocate, because I belong to the group of people who say that food is your first medicine. And why we are facing all sorts of vitamin and mineral deficiencies is because as a nation we are, eating a lot of calories from refined cereals and we are not eating diverse diets. But also from an industry, economical perspective, what happens is the consumer goes to buy a nutraceutical, and if it has very exaggerated claims, इसको खाओगे weight loss हो जाएगा, इसको खाओगे तो एकदम ही brain वो हो जाएगा, your memory will improve. What happens is it creates a certain expectation, it creates a hype, and obviously because it is a supplement, it acts in a more sustained manner, and then the consumer feels कि अरे ये तो weight loss तो हुआ नहीं मेरा, so and then it comes crashing down, and then the trust is broken. So hence, it is equally important from a market perspective also to in a scientifically correct manner, brand what nutraceuticals are. They are not medicines, they are not replacement for your healthy diet, but yes, they are supplements and they need to be consumed by that population which has those deficiencies. And then the second thing, in terms of how does government promote it, I think one of the major things that government really needs to do is invest in a lot of R&D. Ayurveda is one area where I feel that the consumer demand is more than the amount of investment that the public investment that has been there in terms of scientifically validating a lot of these products. Because once that is done, it will not only benefit domestic consumer market, but also export market, because it is all driven by how scientifically back these claims are.
Now you speak a lot about tall claims that are made. The problem is that besides the government regulating something, there has to be some sort of a self-regulation as well by these companies. At the end of the day, that's the real solution we're looking at. And interestingly, you mentioned about how India is now transitioning, becoming more aware about nutrition. I tried to focus on my fitness, and the maximum knowledge that I had for the longest time was carbs kitna lena hai, protein, and all your other fiber, etc., etc. But now you have people focusing on gene level diets as well. They're getting data from their genes, and they're looking at what's the best as per their genes as well. So how important is technology becoming in all these issues?
So, about 7-8 years ago, when I was working for the Harvard School of Public Health's India Research Center, I was young, and one of the first meetings that we had with the faculty was with this group that was into, microbiome, precision medicine, and microbiota. And I was like, guys, we are here to do public health. I don't even know how relevant, how scalable it is in the Indian context. But times have really changed, and personalized nutrition, I'm sure everybody sitting in this hall and whoever is listening to this summit, if given a chance, would want personalized nutrition advice. Who won't want, for their genes to be tested and for their, nutrition counseling to be very, very personalized basis the gut microbiome that I have. But we have to understand the perspective that it is, of course, very, very expensive. It is when we are, and I'm an advocate of public health nutrition. So it is very, very limited to the urban paying class, very, very limited to niche categories, and this science is evolving. But when we talk about personalized and customized nutrition advice, I think the role of AI and technology is something that can be leveraged to really scale up personalized nutrition advice. Like, one of the things we've been trying to work on as a group of researchers has been how to use AI to really give personalized advice based on scientific evidence on what is nutritious.
Now, it's interesting that you're working so hard for it. All that people do these days is they just look for a prompt on the internet and they put that in ChatGPT and, try to get the best diet advice as possible. How good is it going to be? That's, of course, a larger question, a larger context, calls for a larger debate as well.
And what scientific evidence is feeding these algorithms? I think
Absolutely.
As consumers and as a nation, we should be very careful of, because tomorrow your ChatGPT is going to tell you what to eat and what not to eat. So we need to be very careful of what we are training our algorithms with, and that it is trained and informed with science that is, scientifically valid and also very contextual to the country.
Absolutely. It's an interesting point that you're making. The kind of information that is being fed, the source of it, the information on that is very scant. So I think we need to take it with a pinch of salt as well. Before we wrap, Dr. Singh, we talk about how yoga has become the soft power that India has exported to the world. Can this industry be the next soft power that India can export to the world?
Of course, why not? Because as per the Viksit Bharat, that document, now by 2047 we say that it can become the 100 billion, industry, US dollars. So actually for that, India is very rich in, we know that Ayurvedic knowledge, traditional knowledge, we are very much rich. Only where we are lacking actually the scientific validation. And we have all the ecosystem available in India. So, basically like CSIR, where traditional knowledge, this digital library also exists. we can leverage and use that databases where all the, our traditional, knowledge has been taxed. And we, with the, evolving the partnership with the industry, where we can use industry for the industry, can invest in this money, in this industry, in this area, and we can come up with a lot of data, and already we have knowledge ecosystem with the all expertise available, with lot of safety data and quality assurance, with CSIR labs. We can actually, use these raw materials and preclinical studies, clinical validation, regulatory studies, all data, all actually protocols have been standardized. Only thing is that we have to create systematic data for export of these kind of products. And where raw material is available in India, we should take advantage of this. Already industry is taking advantage of this raw material. And one example we can see of ashwagandha. How ashwagandha, lot of actually we get advisory from the European Food Safety Authority also, that we should, again quality issues come. So if we actually maintain the quality of our products, then definitely we can actually reach to the target of this industry.
Absolutely. I think that's the biggest takeaway of this panel discussion. The fact that it's, the growth of this industry is not only in terms of building more fancy products or creating catchy labels and hashtags. It's also ensuring that you first validate India's ancient wisdom with modern science, and then eventually earn consumer trust as well. I think it's a long way to go, but the future is bright, and there's a large opportunity as well, and especially with the kind of research that Dr. Awasthi and Dr. Singh are doing as well. Really appreciate you for joining us. A big round of applause there for our panel of experts here.
All right. Thank you, Ashish, for asking all the right questions. And to both of our doctor panelists, I ask that you please remain on stage. Can we please have Pooja Sethi back on stage, Managing Editor of Times Network Digital, to present each of our doctors, Dr. Awasthi and Dr. Singh, with the token of our appreciation. Thank you for being here. Thank you, Ashish. This is our gesture of gratitude for sharing your rich range of insights here at the India Health Summit and Awards 2025. Thank you. Thank you, ladies. Thank you once again.